Good afternoon, everyone. Welcome to this session. This very interesting one because we're going to talk about the newest laser. Very exciting. So I think to not be wasting the time, shall we start with our first presenter? Dr. Sang Jonathan Taping. Am I correct? Sorry. Okay. Yeah, he's going to talk about the 2910 nanometer laser in Asian skin. So please welcome.
Oh, hi everyone. My name is Jonathan from Taiwan, currently working in the Taiwan Adventist Hospital. Today I'll be sharing this topic on the 2910 nanometer laser in the Asian skin. Basically, the practical strategies for lifting, neck rejuvenation, and enhanced post-laser recovery. We understand that where we have been, the current skin rejuvenation laser devices were limited versatilities, such as the depths and modes. And then there's higher risk immediate results for the skin of colors, and very discomfort score, moderate to severe, even with an anesthetic, increased treatment times, and also the thermal impact can be quite high for CO2 laser and can be quite low for Urbignat, and varying downtime. So where we are going right now is like a 2910 nanometer fiber laser with the maximum versatility is what I'm introducing right now today. Increased safety, efficacy for the skin of color, and less discomfort, mild to moderate, with the topical anesthesia optional. It only takes about 10 to 15 minutes treatment time. Thermal impact is adjustable and reduced downtime to 3 days to 1 week. What we call this is cold ablation. It only creates minimum heat diffusion. It's a unique wavelength which has the highest water absorptions. And with 95% ablation and only 5% coagulation. And this is what we create in a histological view. The conventional CO2 laser that create a lot of energies that also creating a lot of coagulation and doing damage to the surrounding tissue. First of all, I would like to share some cases regarding facial lifting and tightening. The 2910 cold ablation, why we call this cold ablation is because it creates the damage to the skin, but only limited coagulation to the surrounding tissues, that enhancing the skin recovery and later on the remodeling of the skin. So after the microablative channels are created, the control wound healing, and then the fibroblast activation goes to neocollagenesis, dermal remodeling, and then they give us the clinical outcome for the tightening, jawline definition, neck rejuvenation. Why Asian skin needs a different approach? First of all, we have a higher melanocyte activity, higher PIH risk, longer inflammation phase, more sensitive to the thermal injury. So with this 2910 cold fiber laser to your right-hand side, the energy and also the damage is adjustable, and less thermal damage, safer remodeling, and faster recovery. In comparing to the CO2 laser, there's a large thermal damage in compared to the Urbignat as the minimum thermal damage. When we say minimal thermal damage, that means minimal remodeling. Here's a 70-year-old man. What I've done was something called ultra mode and clear mode. When we say ultra mode, it's more like the coring of the skin, and then it goes all the way to 750 micron. And then with only one coagulation level. Another one is a clear mode. It's more like a superficial peeling, and then to adjust the skin, the striatum corneum part. And also with the laser coring. Laser coring is very similar to skin reduction. What we have done with the surgical knife, the plastic surgeon, and what we're using here is utilizing the laser. It's more like a laser surgery. And then what I have done here was to use this red dot here. I go according to the vectors along the nasolabial fold and also on the preauricular region. Here's another 35-year-old lady. She's not happy about the skin, the scar, and also some of the sagging of the nasolabial fold. So after the treatment, on day 11, day 30, day 60, we see the tightening of the skin and also the lifting and also the less defined of the nasolabial fold. Here's another 45-year-old lady. All those are without any real surgery. It's only purely done by the laser. And what we have here is the improvement of the nasolabial fold. And next to the neck laxity, the aging of the neck involves complex anatomical and physiological changes, including dermal collagen depletion, elastin fragmentation, skin laxity, platysmal band formation, and submental volume accumulation. So the neck is often one of the earliest regions revealing the age-related changes, the wrinkles, the necklines, the crevices, also the loss of the jawline definitions. So effective rejuvenation remains challenging because a thinner skin, critical underlying structure also limit tolerance to the thermal damage. We used to use the ablative resurfacing, and which can improve all those photo damage necklines. However, the traditional CO2 laser resurfacing increased PIH, prolonged downtime, delay healing, and higher risk of the scarring. Here's another 70-year-old man. After one-time treatment, 2 months post one treatment, we can see the great improvement of the neck laxity and sagging. What we use here is the jawline and lower chin. We have the laser coring. Here's another 60-year-old lady. After the thyroidectomy, we have the scarring. And then now we also do the whole neck rejuvenation. We see the great improvement of the neck scar and also the tightening of the skin. The last will be the enhanced recovery and laser assist drug delivery. So what I use, my protocol would be after this big energy delivered, we see the redness, we see the inflammation. So cooling, hydrogel dressing, a gentle cleanser, moisturizer starting from 24 hours. From day 1 to day 3, I continue to use exosome, some growth factors. Day 3 to 7, the barrier repair, and also later on will be the remodeling phase. We see here two young men with and without the exosome. With our exosome, we don't see a big differences regarding the shortening of the redness or enhancing in the first 7 days. However, if I do a split phase without the exosome on patient's right and with the exosome on patient's left, the patient revealed feedback a faster healing process and then a faster of this crust peeling on the exosome side, with the exosome side. So why 2910 nanometer is an ideal AIDD? It's a uniform microchannels, minimum thermal coagulation, rapid epithelialization, which can enhance the drug penetration, growth factor delivery, exosome uptake, recovery time, and skin rejuvenation. So LADD was introduced to 2004 by Dr. Anderson. He introduced the term called microthermal zone. The use of laser allows delivery of the drug in a uniform and controlled way. So laser stimulated drug delivery by the means of the three process. First of all, tissue ablation, and then the photomechanical wave resulting in the conversion of light into the mechanical energy. And then the skin barrier got ruptured, and then the medication can penetrate. So here's a quick a comparison of this 2910 cold fiber laser to CO2 Erbium and also other means of the thermal microneedle. We see this is adjustable depths, superficial to deep, and thermal damage is very, very at the minimum. And then skin type, safe for all skin types, and resurfacing power is very high. And then this is a very new modality, has been in the market for about 4 years. In Asia, about 1 year. So we're still accumulating more of the evidence, but as a result showing in the past years, the white paper is actually enhancing the drug delivery and also those molecules penetrations. So according to this chart, we talk about the growth factor may be a bit too large for this cold fiber. And then as the daily skin care, daily skin activity, it really depends on the product. And as for the filler and other biostimulators, it might need injectable or a microneedle. So this 2910 cold fiber laser is arguably the Flexible, single device solution for laser-assisted transdermal drug delivery, which reach both superficial and deep dermis, has low collateral damage, supports a wide range of drug, allows downtime to be modulated. But I have to say it's not a universal replacement, including for some of the heat-sensitive or fragile skin cases, which we might need some non-ablative methods that are better. So for my treatment algorithm, if we try to improve the skin texture, we use the clear mode with the superficial mode. And then if we want to use the wrinkles, we can go all the way to 1,000 micron, or even to 2,000 micron, but 1,000 micron would be safer. The laxity, we use the laser coring for the tissue reduction, and also the ultra mode. And also at the end, with the recovery enhancement, we use the ultra mode. So key message to take back would be 2910 nanometer cold fiber laser combined efficient tissue remodeling with the minimum thermal damage. It's a unique cold ablation profiles, offers a very important safety advantage, especially to the Asian skin. And beyond resurfacing, it expands the treatment paradigm toward facial tightening, neck rejuvenation, enhanced regenerative recovery. Thank you. This will be my presentation.
So thank you, Dr. Theng, for such a beautiful cases of yours. Next, I would like to invite another speaker, Dr. Chandra Permana. He is from Indonesia. Please give him a round of applause. And he's going to be talking about 785 nanometers picosecond laser across spectrum of facial pigmentary disorders.
Hi, everyone. I know today I'm standing between you and your nap, but I'll try to make this presentation more stimulating. So it is truly an honor and a privilege for me to stand here in CAS Asia 2026. My name is Dr. Chandra. I'm from Indonesia. I'm an aesthetic physician with special interest and focus practice in aesthetic medicine. So today I would like to discuss an area that represents continued challenge in aesthetic medicine. What is that? Yes, facial pigmentary disorder. So facial pigmentary disorder remain among the most common reason why patients seek aesthetic treatment in daily practice, whether we are dealing with PIH, solar lentigines, freckles, or melasma. We know that these conditions are generally benign lesions, but they can have substantial impact on our patient confidence and quality of life. So, despite a wide range of treatment options available today, we know that melasma is still considered the most challenging pigmentary disorder to manage successfully. And our patients increasingly expect faster results with minimal downtime, while we are, as a clinician, must balance between efficacy and safety, particularly in darker skin phototype where the risk of PIH is higher. At the same time, advances in laser technology have significantly expanded to our therapeutic option. So among this innovation, picosecond laser have attracted considerable attention due to their mechanism, not only reduce the pigmentary, but also have a photomechanical mechanism that enabling pigment fragmentation very effective. So today, in this presentation, I would like to share my early clinical experience using 785 nanometer picosecond laser across several facial pigmentary disorder. I hope this is not only provide insight into the efficacy of this waveline, but I hope this is also foster discussion on how we can best integrate this waveline in our own aesthetic practices. Okay, to better understand the rationale behind this approach, let's first look at the current landscape of facial pigmentary disorder and the challenge we encounter in daily practice, particularly in managing melasma. Recent research has provided complex pathophysiology of melasma. In the past, we believe melasma was largely a disease of melanocyte alone. But in fact, melasma associated with wide range of pathological changes. So this finding further emphasized that melasma is multifactorial and highly complex disease, requiring us move beyond a purely centered pigment, but also we have to consider best treatment strategies for the patient. So after understanding how complex melasma really is, the next question becomes how we should manage melasma. For many years, topical therapy has been considered a cornerstone of melasma management. But when we know that topical agents remain essential, but clinical experience has shown that they are often insufficient to prevent relapse or disease exacerbation when used alone. So today we recognize that successful melasma management should be approached through multimodal strategy. Consistent with this concept, we now have a newer topical formulation, newer advanced laser technologies, and oral emerging therapies that allow for more personalized and comprehensive treatment. Then this brings us to the important question: why is 785 nanometer is maybe a new solution or maybe a revolution in laser pigment therapy? The answer lies in its unique interaction with skin chromophores. So picosecond laser do not simply hit the pigment. Instead, they generate a predominantly photomechanical mechanism that scatters pigment particle into much smaller fragments. These microscopic fragments can then be more efficiently cleared by our body macrophages through natural elimination processes. Then why 785? So the 785 fills intermediate space between 1064 and 532 on the melanin absorption spectrum. The 785 has a higher absorption rate for melanin compared to the hemoglobin. This is make it highly effective for targeting melanin while minimizing damage to the blood vessel, which in return reduce patient discomfort and recovery time. This wavelength especially advantageous for most our patients, so this Asian patient population with Fitzpatrick type 3 and 4, where too high absorption at 532 might risk Telmar injury, and while 1064 might penetrate too deeply with a reduced pigment targeting. And interestingly, a study published in the Journal of Cosmetic Dermatology 2024 demonstrated compelling histologic evidence of genuine skin regeneration following 785 nanometer picosecond laser. The investigator observed increased collagen tightness and collagen density accompanied by higher expression of collagen type 1, type 3, and STO1. Among these findings, increased collagen type 3 is particularly noteworthy. Why is that important? Because we know collagen type 3 is the first collagen synthesized during our early stage wound healing. So in other words, it serves as biological marker indicating that an active regenerative process has been initiated within the skin. So over time, this newly formed collagen type 3 gradually replaced by collagen type 1, which provide greater tensile strength and structural support. Therefore, the presence of collagen type 3 only 4 weeks following the treatment strongly suggests that a meaningful dermal remodeling has been initiated within the skin. But we know that most importantly of this technology is, of course, the clinical outcome. So multiple studies have reported significant pigmentary disorder lesion. This is also accompanied by meaningful reduction in melanin index. So all while maintaining favorable safety profile and low incidence of adverse event. And I will now walk you through some selected clinical cases. So I collected a total of 30 patients, aged between 20 and 60 years old. All participants presented with Fitzpatrick type 3 and 4, which represent medium to darker skin tone, common across many our Southeast Asian patient population. So for the indication were diverse, including melasma, freckles, solar lentigens, and PIH. For the device, I'm using 785 nanometer picosecond laser with a fractionated and unfractionated handpiece utilized to transfer the treatment. And for the assessment, I collected comprehensive patient data from medical record, including demographic, treatment parameters, and of course, most importantly, photographic documentation to objective comparison between before and after. And to support and maintain the treatment also included home complementary regimen, where patients were prescribed topical cream based on their primary skin concern. For the outcomes, even after a single session, we can see a significant global aesthetic improvement, which was evident in tone, clarity, and textural refinement. So this is Mrs. M, 50 years old, female patient, presenting with extensive melasma involving both epidermal and dermal layer. She reported that the spot were neither itchy, hot nor painful. She denied any prior history of acne or irritation in the affected area. She stated that having used various prescription cream from multiple clinics for over 2 until 3 years without significant improvement. The patient has 1 child and there is no history of taking hormonal medication such as birth control nor any regular use of other systemic drug. And there is no family history of melasma, neither her mother nor her sister has experienced similar complaints. From the dermatological evaluation, as we can see, revealed dark brown patches with macule with well-defined border and irregular shape, predominantly in the centrofacial area. For the treatment plan, she underwent a single session of 785 nanometer picosecond laser, followed by daily use of typical prescription cream. And prior to the therapy, the patient was administered with topical anesthesia consisting of 2.5% lidocaine and prilocaine for 30-45 minutes. Then the anesthesia was removed using sterile gauze. And for the endpoint of the therapy, it was identified by the presence of the mild redness or erythema and warm palpable sensation on the skin. And following the procedure, cold compress was applied to alleviate the warming sensation experienced by the patient. This is the before, after, right after the treatment, and 4 until 6 weeks post the treatment. So we can, after 4 until 6 weeks post the treatment, we can appreciate a notable reduction in pigment load and also visible decrease in pigment density. Her overall skin tone also brighter and more even, and most importantly, the diffuse darkness has softened significantly. Okay, we have already gone through a representative case in detail. Because of limit of the time, I will show you some more additional successful cases using this wavelength, but I won't elaborate further. But I believe that you'll be able to appreciate the consistency of the result visually. So what makes this exploration particularly compelling? Because this is only need 4 until 6 weeks to see a visible result following a single treatment, which speak to the potential of 785 picosecond laser to deliver high impact outcome with a minimal downtime will be combined with topical therapy. This is melasma with solar lentigens. Is for PIH, also for PIH. This is the interesting one because this is not melasma, this is ochronosis. So this is melasma overlying ochronosis. So I try using the 785 and topical without any hydroquinone. This is only use retinoic acid and low potency of steroid and also tranexamic acid topical. This is also ochronosis. And this is a very thick melasma. As you can see, from the endpoint of the therapy, the target is mild erythema. And if patient not uncomfortable with the warming sensation, we can apply cold compress right after the treatment. This is for freckles. This is for PIH. Okay, for this one, this is not just a one session. So this is a really interesting story behind this patient. So this is not tattoo. This is an accidental mark. So she said that he has had an accident in elementary school, and then the scar is not disappear after many years. So for the first time meeting this patient, we are not targeting this marks because she only wants to brighten her skin. Then I try to suggest her to try to target the 785 to this mark. And then as you can see, after 6 times of the treatment, the lesion is become brighter and maybe gonna be disappear for the next session. Okay, thank you.
Thank you. That was really interesting cases. Very nice. A lot of good results. So next we have Dr. Valeria Campos from Brazil. She will talk about the layer by layer unlocking skin regeneration with hand pico and ProDeep. So please welcome.
Before anything, I'd like to thank you, the 2 beautiful chairwomen. Yeah, not just chairman, congratulations. For those who don't know me, I'm Valeria Campos. As said before, I'm a dermatologist from Brazil, who had the opportunity to study early in my career at Harvard Medical School, where I got my fellowship with Rox Anderson, and now I'm back to Brazil when I try to do some research over there. I have opportunity to work many devices, but the one I have to say with conflict of interest, it's this equipment. It's a platform. It's now half American, half Brazilian. And why do I like to work with different wavelengths? I like this combination because like skin aging is not just about like pigment, everything. It's like multi-factor phenomenon that involves epidermal, pigmentary, vascular, and dermal changes. So why should you combine energy-based devices? Because there is no one so far, single equipment, that you are able to treat all these layers. And using this multi-modality, you can have like better results, and you can even like lower, especially for those who live in a country with like a lot of post-inflammatory, like South American or Asia or Africa, this can be useful. And this combination is not about aggressiveness, it's about precision. So you might be asking, Valerie, this is really useful? I don't know about your patient, but my patient after the pandemic, they look like babies. They cannot take any pain anymore. And even the downtime might be a problem. If they say, it's okay with me, the time they have the crust, they keep calling me and said, how long this is, and I have a party today. So I usually work with combination. And between, like, I do a lot of combination, but today I'm gonna share with you the combination that I like the most. First, picosecond laser. Like you, I'm very fond of picosecond laser, and not just us. The word like picosecond laser is considered the new trend in facial rejuvenation with laser. And that's the equipment that I use the most. It's a hand pico, the name of the machine, has 2 wavelengths. Pulse duration can work in nanosecond or picosecond, and has several points. And you might ask again, like, does it worth? We know that the picosecond is the double of a key switch laser. So let's take a look at. Depends. If you ask me, Valerie, should I buy not just the hand pico or any picosecond laser? The majority of the time, we work with energy, photothermal. So you're going to remove a hair, you work with nanosecond. So the more heat, the better. Now, when you work with picosecond or key switch laser, you work more with this photoacoustic. It's not about heat. It's much more about this acoustic effect. If you're thinking about, I'm going to remove like, it's more for pigment, I would say maybe it's worth buying, maybe not. Of course, it's better because we are talking about 3-0 of difference. But if you speak about rejuvenation and melasma, definitely you should buy a key switch laser. So 3-0, physically, it is a lot of difference. If you took the speed between these two vehicles, it's 3-0. And here, for us in laser, it is a lot. So what it makes it so special? If you're using this fractionated, what happens? You have this concentration point of energy that's capable of producing the plasma, internal plasma. And then you have this LIOBs, laser-induced optical breakdown. This is a game changer. It changed the way you are going to see your treatment. This is a phenomenon super fast. This is a shock wave. This is not about the thermal effect. And it's going to produce this neocollagenesis and neoelastogenesis. That's why, as was said before, it was good to come after you because you explain everything. Because melasma, we do need more collagen. That's why after I started using the picosecond, it changed the game. If you're going to buy equipment, I hardly recommend you to take a look and make sure it's not all the same. Make sure you have these LIOBs. And the second combination that I like, it is a no-ablasive laser. So using the picosecond, how can I use it? I can use low energy, I call it like picotone. The downtime is 1 day you can go, but you can go more, and then you have this kind of result. But it's still okay. Like this is a procedure usually I do on Friday. Monday the patient are back. It's no ablative, so it means that you can apply a makeup on. Some results here before and after. This is a patient after three months after 2 sections. I do like a lot for this around this area. This is after 1 single. This patient is 3 months after 1 single. Look at closer to appreciate the result. Another patient, 3 months after 3 sections. So you can use less energy. Here, more energy, better results. Here too, this patient after 1 single treatment. What about dark skin type? Yes, it's very safe. This is a patient after 1 single section. Of course, for melasma, you need several, but you can see some results here you can appreciate. Can I use it for drug delivery? Yes. The literature shows that, yes, you can use for drug delivery. And I have done a study with my colleagues in Brazil, associated with antioxidant. And here is the result. Yes, we did have like a statistically significant in reduction of pigmentary and wrinkles. And was done. This was 60 treatment done for my resident. You know, the residents usually, they're not that great. Not 1 single case of post-inflammatory hyperpigmentation. Here are the results regarding spots and wrinkles. Some example, this patient, 3 months after 3 treatment, dark skin type, this got 4 treatment. Even for people like older, it's a good choice too. Another patient with melasma. Very dark. Before and after. You can, if you pay attention, even the texture of the skin is much better. Post-inflammatory hyperpigmentation. Here I use a localized point of 532. When I use the 532 when I want to like kind of destroy. Most of the time for the whole face, I use the 1064. And here, this was a disaster. Like 3 weeks before Christmas, I was doing a procedure, and this is a post-inflammatory. Thank God, saved my Christmas. 1 section associated with post-inflammatory. Much better. And the second, what do you use? No ablative fractional laser. My favorite wavelength is the 1340. So it's the same equipment, the same platform. Why do I like the 3040? Because it's a no ablative laser, it's absorbed by water and produced. But what's the difference? I do have experience with another wavelength like 1540, 1550. It's 10 times less absorbed by water. So what does it mean? That goes much deeper. So here you can appreciate some result. This is after 1 single session, 30 days after 1 treatment. Look at this closer. Of course, if you use less energy, usually for men, sorry, they feel more pain, especially the Latin men. So I decrease the pain, then I can have good results after 3 treatments. It's a good indication for men because the men usually, especially in Brazil, they don't want the other man, the Latin man is supposed to not do the procedure. So they don't want the friends to get to know, so it's no ablative, so it's easy to just pretend you have like an allergy or something. For scar here and rejuvenation, 3 treatments, 30 days after 3 treatments, same patient. Another patient is skin type 4, 5, 2 months after 2 treatments. Yeah. And I do like sometimes to associate the patient got treatment with IPL on the whole face and just the 34th in her eyes. Here, associate with like micro-roodling. And here, I got like treatment on the whole face with the Erbium. And just the eyes, I use the 34th. I look at the result. 1 single treatment. Outside the face, yes. This is for treatment for a neck, 2 treatments, 60 days, 2 months, 60 days after 2 treatments. So my tips for those who want to do it, remember, microthermal zone. When do you use a more microthermal zone and when you use less? So when you want to remove more skin, like you want to improve the pigmentation, you choose the 400 microthermal zone. When you got to use more energy, like you want rejuvenation, skin laxity, use 100. And it's good for strias as well. And here for hair. This is one of my favorite indication. Of course, then you use less energy, otherwise you can break your hair. But you can make it even like the matrix and the vessels much better. For scar, acne. So the acne, there is like one hand piece that's collimated. We use it, localize it in the pimples. When do I use it? My favorite indication. Females, for example, this woman is trying to get pregnant, so she gets some rejuvenation and get off the pimples. She cannot take isotretinoin. The guy wants muscles, doesn't want to take anything, so I do localizing his back. Another patient. The earlier you started treating, the less chance of scarring. So don't be worried. You use like to avoid the treatment when we're using isotretinoin, but now I start right away. So you can combination 2, 3. The majority of the time, I combine like 5 technologies. So it depends on, it's not one size fits all. Like this patient, what she doesn't like the color of her life, but she doesn't want to get rid of the freckles. So I decide to do this combination. 1 single treatment. This is a patient elderly. She doesn't care so much about the color, so we want more rejuvenation. So I use it, even I can include a treatment intraoral with the Erbium laser. Single treatment. And in order to get better results, we are talking about regenerative skin so much. So I live here this study that I was part of this study, that it's an algorithm to make your treatment more efficient, something that you can do before and after treatment. For those who want to take a look at the paper, I leave here the contact. And here is my Instagram. For those who want to be in contact with me, I will be more than happy. Thank you very much for the opportunity to show something I do in Brazil. Thank you.
So thank you, Dr. Campos, about the other great presentations. Okay, next I would like to invite the next speakers, Dr. Denise Fernandez from Philippines. Yeah, she's welcomed.
So good afternoon, everyone. Thank you for staying with me today. So I'm Dr. Denise Fernandez from the Philippines, and it's an honor to be here today to share my insights and experiences on acne scar management using fractional CO2 laser with topical PDRN. So I have nothing to disclose for this lecture, and here are my objectives. So as we know, acne is one of the most common skin conditions affecting about 80% of people in their lifetime. 96% of these patients experience low self-esteem, anxiety, and depression. And while the individual lesions tend to be self-limited, the sequelae of scar formation, hyperpigmentation, and associated psychological impairment can be lifelong. Acne scarring results from the rupture of the follicular wall, with release of your inflammatory mediators, which triggers vasodilation, which we clinically see as your post-inflammatory erythema, and or melanogenesis, which we see as your post-inflammatory hyperpigmentation. It can also trigger fibroblast-mediated remodeling, resulting to your hypertrophic or atrophic scar, depending on whether there is a net gain or loss of collagen during the healing process. Now, atrophic scars can be further subdivided into your ice pick, box scar, and rolling scars. Now, since there are different types of acne scars, there are also different modalities available, and we know that combination treatments is usually best for our patients. One of the most commonly used modalities which can potentially address the different types of scars would be your lasers. Let's now zoom in to your CO2 laser. So CO2 laser is one of the oldest and most enduring laser systems to exist for acne scars. So it was first introduced in the 1960s, mainly for cutting and destruction of tissue. By 1990s, ablative CO2 lasers were used for cutaneous resurfacing. And by 2004, fractional CO2 laser was introduced, wherein there are columns of ablation surrounded by normal skin, which potentially reduce the associated side effects traditionally seen with your more abrasive laser types. Currently, fractional CO2 laser has a wide range of applications, from photoaging, scar revision, skin rejuvenation, and even to address pre-malignant lesions and keratinocytic skin cancers. CO2 lasers emit at an infrared wavelength of 10,600 nanometers, selectively targeting water. Upon absorption, laser energy is converted to heat, resulting to vaporization of water-containing structures, which happens to be about 60% of our skin. This results in the creation of what you call the microthermal treatment zones surrounded by undamaged skin, which helps with skin regeneration. Despite these advances, however, fractional CO2 lasers are still certainly capable of damaging the skin enough to cause excessive fibrosis and disruption of melanogenesis, which can cause the following complications. Another potential limitation will be the downtime of about 7 to 10 days associated with erythema, grid marks, scabbing, and scaling, necessitating careful post-procedure care. So this is actually why, despite being an acne and acne scar clinic in the Philippines, we didn't immediately introduce fractional CO2 laser in our service menu. So there was definitely a demand for it. Like patients, especially those who frequent social media, they would come in the clinic specifically asking for the CO2 laser. But we were just hesitant to offer it, knowing that the Filipino skin is also very prone to pigmentation. So how did we address it? Through the addition of your polydeoxyribonucleotide, or PDRN. So PDRN are DNA fragments with potent anti-inflammatory properties. They interact with your A2A receptor, activating the salvage pathway, which promotes cell growth, stimulates angiogenesis, and enhances tissue repair, properties which perfectly complement the fractional CO2 laser. Now, to prove the point, so this is a study by Dr. Sheen et al., wherein they use CO2 laser followed by intradermal PDRN injections, which is how PDRN is usually administered to address traumatic scar on the face of a patient. So after 6 months, there's almost complete resurfacing of the scar and improvement of the pigmentation. Now, when used topically, they have the potential to work synergistically. On one hand, your PDRN enhancing the results and reducing the side effects of your CO2 laser, while CO2 laser enhancing the absorption of your PDRN through laser-assisted drug delivery. So this is also a great modality, especially for patients who may have some needle aversion or those seeking minimal downtime and discomfort, thus offering overall enhanced patient satisfaction. Now, there are other post-laser agents available, and there are studies also supporting their use. However, comparative clinical data comparing these modalities remain to be limited, and this is something that we wanted to address also in this study. So we did a split face study design wherein one side of the face was treated with CO2 followed by application of your topical PDRN. And by PDRN, I mean the medical grade one. So this is different from the cosmetics. No? So I know PDRN is also very popular as part of cosmetics, but this is the one that is supposed to be injected or indicated for intradermal injections, and the other side either with CO2 alone or CO2 with a different agent. So we used the Goodman and Barron qualitative scar grading system to objectively assess the severity of your scars. And now I will be sharing with you 3 cases. So for our first patient, we have a 24-year-old female presenting with inflammatory papules associated with grade 3 atrophic scars, post-inflammatory erythema, and post-inflammatory hyperpigmentation. So we treated the right side with CO2 alone and the left side with CO2 and PDRN. So there was overall improvement in her skin quality, although the right side treated with CO2 alone appeared to have more inflammatory acne as compared to the left side. Now, looking at side by side, so the right side, you could still see some of the edges or the shadows from the scars as compared to the left side, which appears to be smoother. There are some new pigmentations which were not present during the baseline photos, which means that the patient could have benefited from topical or maybe even oral medications for better control of her acne, which we didn't give her in this case to make sure that the results that we're getting is really just from the treatment alone. So for our next patient, so similar case presenting with acne, post-inflammatory erythema, post-inflammatory hyperpigmentation, and grade 3 atrophic scars. So this time we treated the right side with exosomes and the left side with PDRN. So there was global improvement in her skin quality, more than just the scars. There was improvement in the pigmentation, more even skin tone. Skin appears softer, smoother, and if you look at the right side as compared to the left side, it was almost indistinguishable. The patient reported 70 to 80% improvement of acne scars with comparable level of improvement on the right side and the left side. Lastly, we have a 30-year-old female presenting with nodules, papules, PIH, PIE, and grade 2 atrophic scars. So this time we treated the right side with topical poly-L-lactic acid or PLLA and the left side with PDRN as well. Now, if you look at the right side treated with PLLA, so there was improvement of acne, although again, similar to the one treated with CO2 alone, you could still appreciate some of the edges of the scars, and there is lightening of the pigmentation, but you could still see it there, as compared to the right side with almost complete resolution of the hyperpigmentation. The skin also appears to be smoother. Now, comparing both sides, overall, her skin appears to be smoother, tighter pores, and definitely less oily skin. Now, comparing the 3 products used. So we have established the many benefits and mechanisms of action of your PDRN. Exosomes is another very popular product with a lot of indications as well, although it remains to be limited for topical use. At least in the Philippines, it is not yet FDA approved for intradermal injections. And another limitation for our patients would be the cost, also depending on the brand, depending on the source of your exosomes. Lastly, this is something that is relatively new, so your PLLA. Traditionally, PLLA has been used as a collagen-stimulating injectable filler, but there are topical formulations available now for volume restoration, anti-aging, densifying dermal layers, and addressing atrophic acne scars. From its mechanism of action, we know that it stimulates collagen production via your fibroblasts, so you could appreciate more or less why it may not be very effective for pigmentation concerns. Another issue would be particle irregularities, unevenness, and possibility of granuloma formation. Hence, vigorous mixing is required, and proper settings of CO2 is necessary to ensure proper penetration of your product. So this is a nice algorithm that I saw online on how to optimize our laser-assisted drug delivery. So first and foremost, of course, proper patient selection is very important. So for certain populations like the elderly, the skin is definitely more prone to complications, so we might need to adjust the settings, the fluence of our lasers, and this is another very good application of your laser-assisted drug delivery, as the patient would be able to get better results despite more conservative settings. Of course, the most important will be the type of laser and the product that we're going to use for your LADD. So for the laser, this same study, they tried topical application and compared it with non-ablative fractional laser and with ablative fractional laser, and they found no difference between topical application and non-ablative fractional laser. So the best option when it comes to your laser-assisted drug delivery would remain to be your ablative fractional lasers. For the product use, so of course the lower the density is better. So it's usually molecular size of about 500 kilodaltons or less, or 5% density, applied within the first 30 minutes of your laser treatment with gentle massaging for more even distribution of the product. So to summarize, so we have seen a synergism between fractional CO2 laser and topical PDRN with outcomes comparable or potentially even superior to other skin boosters. So this makes PDRN a valuable option for post-laser adjunctive therapies. Its easy integration into existing CO2 protocols makes it a practical option for clinicians already performing fractional CO2. And to close this lecture, I would like to leave you with this word. So one of my mentors once told me that the best device, the best product is not the newest one, but the one that we already have. As clinicians, our role is to optimize these devices, these technologies, to give our patients the best results. That is where true innovation lies. And with that, thank you for your kind attention and congratulations to all the organizers of IMCAS 2026.